Now, from the News Channel 5 network, this is Medical Mondays.
And good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. Tonight's topic, radiation as part of cancer therapy, and probably a big chunk of what we're going to talk about tonight, prostate cancer and the radiation therapy that goes along with that. I have Dr. James Gray with me here from Tennessee Oncology. Thank you for being our guest tonight.
Thank you for having me tonight.
You have been a radiation oncologist for how long now?
Close to 30 years, I guess. I graduated here at Vanderbilt 30 years ago.
Wow, congratulations, by the way.
Yeah.
Obviously, probably a lot of change you've seen over the last 30 years.
Yeah, it's been really fun to see the technology and how it changes and how much more we can do for our patients now than we could when I started into the field 30 years ago.
And that's definitely the good news part of it. We were talking a little bit before the show. You said about 60% of the patients you see have prostate cancer. Why such a big number there?
It's been how my personal practice has evolved here in Nashville. I've always had an interest in prostate cancer, and over the years I had the opportunity to help develop some new programs in treating prostate cancer here. For example, a radioactive seed implant program here that we first started at Centennial Medical Center, but exists at other centers as well throughout town. And I had the great fortune to be able to help develop that and bring that into this area. That led to a lot of interest in continuing to do external radiation practices. More recently, for example, treatment with CyberKnife and other techniques.
Wow.
So it's been a lot of fun, and that's made my personal practice be more dominantly prostate cancer than anything else.
And I want to talk about the seed therapy. I was reading up on it, and it really is interesting to learn about, and it seems like there's so much promise with this type of therapy. So we'll get to that a little bit later on, but let's just talk about radiation therapy as the big umbrella. Why do you do radiation as part of cancer treatment?
Well, radiation is one of the tools that we use to treat all kinds of cancers. The basic three tools you have are surgery, chemotherapy, and radiation therapy. And there are a lot of tumors in which we may use all three of those tools in our efforts to cure the patient or to alleviate their suffering. And so radiation is one of the major tools. If you look at all cancer patients, probably about 60 or 70% of cancer patients eventually will receive radiation as a part of their treatment.
And what should people expect from the radiation therapy? What are the pros? What are the cons? What are the side effects of it?
Well, it's totally dependent upon what we're treating. Obviously, the side effects for treating, say, a throat cancer or a laryngeal cancer is going to be very different than the side effect profile of treating prostate cancer or cancer of the female organs or something of that nature. So it has to do with where you're aiming the radiation. But that's the key. Radiation is aimed, with rare exception, such as total body irradiation in a setting of leukemia. We are focusing our radiation very specifically at one part of the body. And that gives us the advantage that we can be focused and therefore not deliver any of the toxic effects of radiation to the other parts of the body at that time.
Would you say radiation, that a cancer patient, I mean 90%, 100%, what are going to have part of their treatment is radiation?
Oh, well, it's not 90%, but it probably is. Statistically, about 60% of all cancer patients eventually have radiation as part of their treatment when you look at all cancers.
I want to take this time and remind anybody, if you have a question about radiation as part of cancer treatment, maybe you're going through treatment right now or just told that you do have cancer and wondering, oh gosh, what am I getting into with radiation? Go ahead and give us a call. Also, I know a lot of people have been touched by prostate cancer, and this is your time to get your questions answered. This guy knows all about it, so go ahead and give us a call. The number's on the screen. 615-737 is the number to call. All the lines are open right now. Just check. So if you want to get through, call right now. We will get your question answered tonight. Dr. Gray, when you first see a patient come in, what do you like to tell them when you're talking to them about having radiation therapy? What do you tell them at the get-go?
Well, it's critical to, my consultation is first to decide, is radiation an appropriate type of treatment for that particular patient? It depends upon the type of cancer they have. It depends upon the extent of the cancer or the stage of the cancer. All of those come into play when we're making a decision about, is radiation one of the appropriate things we're going to use for this patient? There are patients who their entire curative treatment course will be done with radiation therapy, but in today's world, more often than not, we're combining radiation therapy with surgery or with chemotherapy or both. and that's to bring the maximal benefit to the patient.
And I imagine being a part of Tennessee Oncology, where there are several different doctors under one roof or under several different roofs throughout the mid-state, is it a team of doctors that sit down and say, okay, for this patient, this is what we need to do. Let's decide. How does that work?
Well, it takes different forms. Sometimes it can be simply myself and the referring physician, who might be a surgeon or a medical oncologist within my own group of Tennessee Oncology. And we're discussing just between the two of us, but oftentimes it becomes a more multidisciplinary discussion. We may have a surgeon involved, a pulmonologist involved, a thoracic surgeon involved, a radiation oncologist involved, a medical oncologist involved. All of this is just to bring the right therapy to bear for a patient with lung cancer or another type of cancer in the chest in that example. So the same can be said for breast cancer, for colon cancer, for prostate cancer, for throat cancers, for brain tumors. Most cancers in today's world are approached with a multidisciplinary approach. And one of the things we do for that, for example, is what we call the tumor board, or more specifically a tumor conference. And this is where we all will sit together around a table and we will project images of that particular patient's CT scan, MRI scan, maybe look at these pathology slides of what their particular cancer looks like under the microscope. These discussions then can be held in a give and take between different specialists, and we may have a radiologist there who can help present the images to us. We have a pathologist there who can discuss the specifics of this particular patient's histology, what this cancer looks like under the microscope. And those tumor conferences are, quite frankly, very enjoyable for us because we can interact with our colleagues who we don't necessarily spend time in the clinic with every day. And that's a big part of our job. I attend probably routinely at least 3 or 4 tumor conferences every day. I was in a tumor conference just an hour and a half ago.
And I imagine the outcome for the patient is very positive. When you have several wonderful brains looking at one thing, that the outcome has to be better.
Well, you want to bring in as much expertise as you can, and you don't want to be one-sided. As a radiation oncologist, I have a lot of accumulated expertise about how to use radiation to treat these diseases, but I am very familiar with surgery. I'm very familiar with chemotherapy. I'm not an expert in any of those areas, and so I rely upon colleagues to bring that expertise and to say, okay, how can we interact? How can we do this better? Sometimes it's a fairly defined protocol, if you will. We know in breast cancer we need to do this type of radiation and this type of surgery and this type of chemotherapy. Sometimes patients break the mold. They're an unusual presentation, and it really challenges us, and that's actually fun for us to look at. It's a challenge because that patient's life, or certainly their quality of life, can be on the line. So you look at that as a challenge and you take it very, very seriously, that your decisions in combination with your colleagues are the best for that patient in that individual circumstance.
Good enough. We did have a caller on the line. I guess, Teresa, if you're out there, you can either call back, we'll get right to you, or lines are open. Give us a call now. Anyone. 615-737 is the number to call. We're talking about radiation as part of cancer treatment, prostate cancer. If you have any type of cancer and you know that radiation is going to be a type of that treatment, give us a call. Dr. Gray's here to answer your questions tonight. We will get going through those. What are you seeing as on the horizon as being the new best thing out there when it comes to radiation treatment?
Well, we're trying to develop technology all the time. There's better ways of imaging the patient so that we know that when we aim the radiation, we're putting it on target better. We've, over the last 15 years here in Nashville, for example, been part of the evolution of something called intensity modulated radiation therapy, in which the radiation beams are brought from multiple different directions in order to focus on the area that we're trying to bring radiation to, but not expose other parts of the body to radiation. We use techniques called image-guided radiation therapy, which makes sure that when we're delivering some very specific type of radiation plan, that it's on the target. If you're aiming that radiation at the prostate, for example, but you don't have the patient set up correctly and you aim the radiation at their rectum or their bladder, that's not good. So we take that very, very seriously, and the new techniques that we're developing allow us to be more precise. There's even evolution in the type of radiation we're using. One of the evolutionary things that are available now in Tennessee is called proton beam therapy. Proton beam therapy, it means we're using a different type of energy as opposed to X-rays being delivered to the patient's tumor. you're delivering charged particles. It's actually a proton, which is the nucleus of the hydrogen atom.
Wow.
And if you are beaming protons, which is a little bit more difficult, quite a bit more difficult as a matter of fact, to accelerate them and control them and make them be at the right speed and energy, but they have a different dose deposition pattern when they go into the patient. They go a certain depth and then they stop pretty abruptly, which, if you can fine-tune that correctly, gives us another way of controlling where the radiation goes. But that's not been as available, but it in the future will be. It's available in Tennessee now, both in Knoxville and Memphis, and in about 2 years probably will be available here in Middle Tennessee.
It almost sounds so sci-fi, but really it's something that is used every day, I guess. It's amazing.
To me it is. It's like science fiction coming true, the idea of using a charged particle beam to cure a cancer or to help somebody avoid problems down the road, and you're doing it by not impacting the healthy parts of their body better. It is exciting for the way I grew up and the type of things that I've always been fascinated with. This is just another evolution of what we can do.
Very cool indeed. Okay, we're going to take a quick break. I see we have 2 calls on the line. Still more spaces for other folks if you want to call in, talk about radiation therapy as part of your cancer treatment. We'd love to hear from you tonight. We will be right back after this break.